My name is Elena. This is my catheter revalidation video. Okay, I'm going to walk into the patient's room, perform hand hygiene. Hi, my name is Elena. I'll be your student nurse today. Do you have any questions? We're going to be doing a Foley catheter on you today. I'm going to make sure that my patient's supine on their back. I'm going to make sure that they are going to be able to handle the procedure, perform hand hygiene. Can you please confirm your name and date of birth for me? Any allergies? I'd perform patient privacy. I would raise the bed if I was able to. I would look at the doctor's orders. I would see the last time the patient voided or the last time they were catheterized. I'm now going to perform another hand hygiene. I'm going to raise the blanket but provide privacy as much as possible. I'm going to look at the area and then determine if I need to provide any perennial care if needed. Now I'm going to perform another hand hygiene. I'm going to open my kit, away from me, touching the outer 1-inch borders. I'm now going to grab my drape, only touching the outer 1-inch border, not crossing my sterile field. Going to put the shiny side down under the patient's buttocks. Perform another hand hygiene before I don my sterile gloves. Grab my sterile gloves, get it out of my sterile field on a clean, flat, dry surface. Going to fix my fingers now because they weren't in the correct holes when I first put them on, and I didn't want to contaminate. I will now grab my lube and place it in my kit. Discard, grab my betadine, pour it all over my cotton balls, discard. I'm going to place my tray over. Now I'm going to put my saline onto my catheter. Leave that for later. I'm now going to grab my forceps. Going to grab the area, grab a cotton ball, clean, discard, clean, discard, clean, discard. Lastly, clean the meatus, discard, leaving my forceps with it. Now going to grab my catheter. Going to advance until I see urine. I see urine. I'm going to advance 2 to 3 more inches. Now I'm going to grab with my non-dominant hand and inflate the balloon. I'm going to gently tug to make sure the balloon is in place. If the patient felt any discomfort, I would remove it. Now going to take my hand off the area, remove my saline, discard. Now going to grab the bag and tape it to the inner thigh. Or hang the bag on the non-movable part of the bed below the bladder for gravity. Going to tape on the inner thigh. I'm going to cover the patient back up, lower the bed, remove my gloves, going to document what I did. I put in a Foley catheter. I will document the size, the location, urine volume, the clarity, and the perennial care done during my assessment. I will perform hand hygiene, ask the patient if they need anything before I leave, and I'm done.